Hello, my name is Karen Rice and I'm a physical therapist with Orthopedics Northwest. Today I'm going to review how to perform exercises following your total hip replacement. I'd like to review some basic information before we get started. As with any exercise program, follow your physician's advice and modify as needed if your physician has given you directions that differ from these. The exercises should be performed 3 times per day, starting with about 10 repetitions and increasing as tolerated. You may be able to increase some of the exercises earlier than others, and this is fine. Remember to listen to your body and increase only when you feel ready. Also, it's usually best to allow the leg to come to room temperature prior to performing your exercises, so you may want to remove the icing about 30 minutes before your exercises. It's also helpful to reapply ice following your exercises to reduce pain and swelling. Also, don't forget to spend plenty of time elevating the leg following your surgery to reduce that swelling, which is normal following surgery. To truly elevate your leg, you should have your foot above the level of your heart, and this can be done easily by using 3 pillows and making sure that your upper body is lying flat. Following the exercises, I'll show you what that looks like. Each person is different in the amount of elevation time that's necessary, as some people do tend to get swelling in their lower legs under normal circumstances. So if you notice additional swelling in your leg, it could be that you aren't elevating high enough, or that you're not elevating for a long enough period of time. In that case, spend more time in elevation or get the leg a little bit higher. If that doesn't result in a decrease in swelling, you can contact your doctor for further assistance. So let's get started. The first exercise we're going to do are the ankle pumps. These can be performed lying down or sitting, whichever you prefer. This exercise may seem simple, but it's an important one to help prevent blood clots and also to keep the ankles limber and loose following surgery. Immediately after surgery, as we lie in bed a greater amount of time and walk with short, shallow steps, our heel cords and ankle joints can get tight. Remember to move fully through the motion, stretching in both directions as you perform this exercise. Toes all the way up and then pointed all the way down. Also, make sure you do this exercise with both legs. The next exercise is the quad and glute sets. You'll lie on your back on a bed or a couch with your legs straight. First, you'll straighten your knees by pushing the back of your knee down towards the bed and tightening the muscle on top of your thighs. Next, squeeze the muscle of the buttocks, which cause your hips to fully straighten. Hold this tightening for about 5 seconds, then relax. Repeat once again, starting with pushing the knees down, then straightening the hips, and relax. If you have difficulty doing the 2 steps of this exercise together, you can do them separately, but most people are able to perform the exercises doing both of them together. The next exercise is a short arc quad. Still lying on your back, place a roll under the knee that is approximately 6 to 8 inches in diameter, such as a coffee can, a rolled up pillow, or a towel roll. Though it is placed under the knee, you might find that it's more comfortable if you edge it up slightly towards the thigh. Lift your foot off of the bed, straightening your knee as much as possible. Pause for a second or 2, then slowly lower the foot back down to the starting position. Do not lift your thigh up off the roll while performing this exercise. If it is too difficult in the beginning, you can have someone help you lift the leg until you're able to perform it on your own. The next exercise is the heel slide. Once again, lying on your back, both legs straight. Bend your surgical leg, sliding your heel along the bed toward your bottom until you have it bent as much as possible. Pause for a few seconds in the bent position before returning the leg to a straightened position.
This exercise can be very difficult to perform in the beginning, so you can have someone help you by guiding the leg along until you can do it on your own. Also, a plastic bag or a cookie sheet below the foot can make sliding easier for you.
The next exercise is bridging. Lying on your back, bend both knees until the feet are flat. Raise the hips up off of the bed. Hold for a second and then come back down. Initially, right after surgery, this might be difficult, so you may only be able to raise a little bit, or some people can only just barely unweight the hips. Whatever way that you do, that's fine, but ultimately we're working towards getting the hips up all the way till the hips are straight and then come back down. The next exercise is called hip abduction. Lying flat with both legs straight, slide your surgery leg out to the side and back just to the center. Don't cross the legs, but just to the center. Out to the side and back to the center. It's really important that you don't try to hold the leg in the air while you're doing this. We want it to rest on the bed. It's also important not to roll the leg out and roll it in. We're trying to keep the toes up, towards the ceiling while we slide the leg out to the side and in. Initially, after surgery, you may not be able to go very far, but eventually, as you tolerate, we want you to increase the distance that you bring the leg out to the side. Also very important is to make sure and get help to perform this exercise if it's too difficult right after surgery. Somebody can place their hand underneath the heel and the calf and just help to guide you out to the side and in. This is an example of how to elevate the leg after surgery. The foot is above the knee is above the hip, and the upper body is lying flat down so that the foot is above the level of the heart. You should be performing elevation of the leg multiple times per day in order to reduce swelling after surgery.